here today to share. Dr. Kelly Pryor is here today to share HELA to Hope, conducting an equity impact assessment to create a healthier system of care. In this keynote session, Dr. Kelly Pryor describes conducting a racial and health equity impact assessment on Kentucky's design and implementation of the Family First Prevention Services Act. It focuses on 5 critical areas to build capacity for hope. Participants will identify essential techniques in engaging multiple stakeholders and where to go from here. And now, without further ado, I turn the virtual podium to Dr. Kelly Pryor.
Well, good morning. I think I've done everything correct, right? Leah, you can give me a heads up and let me know if everything's good on you all's end. Can you see my slides?
Now we can. It said that you were screen sharing, but it was black, but now we can see it.
Okay, wonderful, wonderful. Well, good morning, everyone. I am so excited to be here, and I am so grateful to Spalding and DBID's partnership for this, this conference, this academy, and really excited to think about, particularly as a professor and as a teacher, that you all are here getting continuing education credits. I am so honored by the work that you all do for the state of Kentucky and for the children in this state, particularly being a youth development advocate and all of the ways in which we provide from prevention to positive to social justice youth development for our young people around the world, and particularly in this country and in this state. And so I saw all the emojis flying earlier for those who were getting the awards this morning. And I'm going to ask if you all can let those emojis fly for yourselves as well. So can I see some of that in the chat before we get started? Awesome. I'm seeing things come through. So I'm going to need you all to be completely participatory with me. That is kind of how I do. I am going to be teaching as well as talking and telling you the work that we went through and are still going through the SOC 5 grant with DCBS and DBID, and particularly KFPC, who's been a really great partner in that. And so I want to start with a story. Put a 1 or some hearts in the chat if you have heard of Harold and the Purple Crown, or if you've read this story. Okay. Seeing lots of hearts. So for those of you who you're not familiar with Harold and the Purple Crown, I love this story as an example of youth development and youth development practices. And so it really tells the story by Lee Crockett Johnson really talks about, let's see if I can get it navigating here, how one evening after thinking it over, Harold, he goes on a walk. And he takes this walk in the moonlight, and you can see how Harold is carrying his tool that he has with him in that moonlight. But there wasn't any moon, so he had to draw it so he could take that walk in the moonlight. And then he made a long straight path so he wouldn't get lost. Because how many of us, sometimes we need to make our own path so that we don't get lost, right? And he set off on his walk, taking his big purple crown with him. So if you've read the story of Harold and the Purple Crown before, you know throughout this story, it starts as a blank sheet of paper. And Harold draws all the adventures that he wants to have over the course of his time taking a walk in the moonlight. And for me, it really tells this story. I don't know how I did that. It really tells this larger story about hope. And it tells this story in terms of how Harold is bridging for himself what he wants to see in the future, what he has come from in the past, the thought process that he might have about what could take place. And he's drawing that picture along the way. So this title of my presentation and our time together, our dialogue together, is HELA to Hope. Now, children are so funny, right? I have 2 children, 2 small children, and they are constantly looking and watching and hearing us, no matter what we're doing. I think for those of you who have children, whether they be small or whether they are big kids now, you know that experience of how they're constantly looking at us. And so I have a 7 and a 4-year-old, one who is Kentucky born. So I appreciate all of the Kentucky energy that comes with him. And my daughter, she is very intuitive about the things that I'm doing. And she sees me telling these stories and as an advocate in the community, and has recently just really come into practice with me about the work that I've been doing with BKP strategies over the past 2 years or so. And so she asked me last night, as we're talking most nights at the dinner table about what we're doing the next day. And I said, well, I'm gonna be doing a talk tomorrow. I'm speaking. And she said, well, what's the title of it? And I said, okay, well, it's HELA to Hope. And I'm talking about the racial equity impact assessment that we did. And she's like, So she questioned my title. She said, why is it shouldn't it be Hope to HELA? And I said, well, why do you say that? Why should it be Hope to HELA? And she said, hope is just when you're thinking about something happening. And HELA, the Health Equity Learning Academy that you do, that's really about us putting things into action. And so, of course, right, short of like, oh, I think someone's cutting onions. And my tears are coming because she's saying this. It's that she is already having an opportunity to understand that hope is something that we should naturally have in us. And that, as I've talked about with her, hope is something that is a verb. So hope is something that we need to put into action. So I had an opportunity to talk to her a little bit more critically about how HELA, the Health Equity Learning Academy, that is step one to even the larger hope that we want to have in our communities, the change that we want to have to actually liberate our thinking completely about who should have a voice in our community, who should have agency to belong, who should have the opportunities. And so in that conversation, especially as I was trying to show her some things this morning before shuttling her off to school, she said, I just want you to do my hair. And so it was like, we're done. So, but at least that capacity started. And that's where it is with all of us. There's some of this is just a seed. Today, it might be a seed for some of you all that's being planted for the first time. For others, it might be you have heard some of this information before. Hopefully, we've been in conversation with each other at some point. And so we're adding some water to those seeds. And for others of you, I know that you could probably be teaching me some of this stuff. So I'm just going to receive the sunshine that you can lend to this conversation today to help us all grow. So the Health Equity Learning Academy, that is an academy that has BKP started in terms of thinking about how do we actually go through a series of understanding where health is in our community, the essentials of public health, knowing that public health is beyond just the way that we are inoculated. We've talked a lot about inoculations over these past 2 years with COVID and vaccines. It's more than just what process are we putting into place, whether that we're wearing masks or we're social distancing. And it's about the ways in which we are providing opportunities and we have access to those things in our community that are going to have us live our healthiest lives possible. So through this Health Equity Learning Academy, we talk about the essentials of public health. We talk about how we can liberate our thinking, all of our policies that are impacted. Well, oftentimes we think about policies such as the Affordable Care Act, right? Like that's a health policy, or the Child Welfare Act. In some ways, we understand that as a health policy, but really when we're thinking about where are grocery stores built in our community, or how are families supported when they need it the most, those are also health policies in our community, because health is impacted, we are impacted by all the things that are making up the core of our communities, impacts our health. And then power and how power moves. We've talked a lot about how those dynamics, how we can shift those dynamics in community. So this is something that I have generally done with lots of different communities and agencies. And when we started out on this process in terms of talking about family first, HELA was a critical first step. So why is it Health Equity Learning Academy? Why is it HELA and not Health Equity Learning Academy that I share more often? And it is because of this woman right here, my public health heroine in many ways, someone who died without fame or fortune or understanding even the power that she had in this world, the world that was to come, and that is Henrietta Lacks. So the story of Henrietta Lacks is that she was a sharecropper, a farmer, a rural Black woman who lived in Jim Crow South. And in her experience, not only did she not have the opportunity to use her voice and have her agency be heard in community because of the color of her skin, because of her gender, because of the poverty that she lived in and the policies and the time in which she was living within Baltimore, within that time in the 1940s and 1950s. But she went to the hospital and they discovered that this mother had cervical cancer. And these genes in her cervix, the cells, they were super cells. They were super, in some ways, people think of them as superhuman cells that replicated over and over. And today, her cells have been used all over the world, even in outer space. Her cells have been used to advance our understanding about science and knowledge, as well as heal and create cures for diseases. But she laid in that hospital, untreated in many ways, unaware of the power of her cells, kept from her and her family, and she died. It wasn't until a few years ago, actually just about 2 or 3 years ago, that her family was made aware and actually compensated for all of the injustices that happened to her. And some of you all might have heard of the book, The Immortal Life of Henrietta Lacks, which then turned into a film, and that was made about 10 years ago. And so we've all had this deeper now story about Henrietta Lacks, and to the point of her family finally being compensated in some ways and not in the ways in which they needed to be for her. And so when I think about health equity, I think about people like Henrietta Lacks. And I think about the marginalization that so many of our communities face for the intersection of their identities, whether it was from some unfortunate experience in their own life, but more often than not, it is because of things that we do not control. It is because of the color of our skin. It is because of the gender that we are assigned at birth and or the gender that we come into. It is because of religion and poverty. It is because of where we live and the zip code that determines our fate. And that is the world that I don't want my daughter to live in. That is the world that I don't want any of our children in Kentucky or out of, I know there's probably more than 10 states that are represented here, but anywhere in our world to be a part of. And so that is why the Health Equity Learning Academy exists, so that we can get on the same page, so we can start speaking the same language, so we can have these definitions of understanding and know that the heroines of our public health movements and our health equity and the equity that we want to see in the world are oftentimes people who are not getting the praise. And so when we went into the Health Equity Learning Academy, it was really important as we were going to move across this arc, right? Like, we're going to learn the history, we're going to do the deep engagement and have the activities, but we also know that we have hope on the table. And hope is really, it is what I study. It is my research area of interest as well. I write about it a lot, scholarly. but it is made up of, as I've discovered, in three, what I talk about as a three-legged stool. One is agency, or what has been talked about in the past in research as one's willpower. The ability to say, I will, I can, and I have the opportunities to do because my voice is empowered and I feel empowered to use that voice. The other is the pathway. Some might call that the way power. So the willpower, one's agency, the way power, how are we actually using that road, thinking about Harold, how are we having that road to walk on? And are those opportunities available to us because they exist? And then finally, the one that is critical, and I see most readily in the work that I do, particularly around community participation and the participatory approaches, are that authentic community engagement. So when we're talking about community engagement, it's not necessarily just are we having a focus group and are people coming out and listening to our sessions, but that authentic way in which we're building relationships with others in our community. It's the ways in which the young people throughout our time and looking at Family First talk to me about, it was my social worker, it was my counselor at school, it was my aunt that I'm still not able to live with. These are the people that I have built community with. And how that three-legged stool, those three things coming together, that willpower, that way power, and that community power, are really going to lend ourselves to building even a greater capacity for hope in our community. So as many of you probably know, when we started looking at Family First, I'm gonna see if I'm not sure if this timer, I see a timer on my screen, and so I don't want it to impact you all's view here. There we go. So when we started looking at Family First, we had to start at really the basics in terms of doing a racial equity impact assessment. We're looking at policies and practices and programs that might start in a community. And so this policy, this bipartisan bill that passed in 2018, it's really phenomenal to think of the ways in which, especially where we were politically, the political will that existed in 2018, but to know that all forces came together to say, this is an opportunity for us to really enhance the way that we are reducing the way in which children are being reduced from the home. We are enhancing the way we are spending our dollars in the state so that we can really create this full, robust system of care for young people. And so asking those questions in terms of whose children are at risk from removal, who is ensured that they can live with a family and that they are in a placement where they are moving to permanency, or we're improving our high quality for those young people that still need to be in residential treatment and reducing that number. How are we improving access in a way that is going to be most beneficial for young people? And when I think about that, particularly the residential treatment, 2020, we started to see around this country a lot of illumination around race and the intersection of race and gender and power and how that was impacting not only our communities at large, but very specific stories that happened. And here in Kentucky, we know that we experienced that very firsthand through the death of Breonna Taylor. But it was also in 2021 that Ma'Khia Bryant, when we started to really think about how is the child welfare system and the ways in which there are residential treatment facilities creating mental and emotional breakdown for youth in ways in which they are now impacted as we saw in that particular case, where she lost her life at the hands of police that were called on this 15-year-old for a dispute that happened, largely stemming from thinking about residential care treatment facilities. So when we're thinking about family first, we are not having a conversation simply about large, broad systems that need to change. We're having a conversation, as many of you all know, as most of you all know, about lives that are currently being lost as a result of how we need to reform our systems of care and our child welfare system as a whole. And so we had some particular goals that we started to discover in terms of how Kentucky specifically was enacting on this bipartisan bill. Regionally, seeing that the Eastern Mountain Service region was utilizing more in-home service than other regions, and that the greatest need was occurring around pockets around the state, such as Cumberland, Jefferson, Northern Bluegrass, Salt Trail, and Southern Bluegrass service regions. So from there, we started to dig in more specifically in terms of saying, we are looking at family first as a whole. We are looking at how this is impacting the health of a community more specifically, and even more precisely than that, we know that when racial equity is not consciously addressed, racial inequality is often unconsciously replicated. And so how are we going to be as explicit as possible in terms of disaggregating our data, looking at the racial impact that the data is having, as well as hearing from the lived experience of staff, of youth, of parents, and of the agencies that are working across the state. So in looking at some of the data, and this is data that has not changed much since 2021, but this is the new data as of this month, of the amount of children who are in care, out-of-home care. And as you see there at the bottom on these reports that are published, Black and African American children, they're 18% of the number of children in Kentucky in an out-of-home care place with active placement. And they're 9%, 9 to 10% of the state's entire child population. And then when we're looking at that overall, that is above the average population of youth in the state who are in care overall. So over 1.4% compared to less than 1% of those who are in care in the state's population of children overall that we see in comparison to their other racial counterparts. So we know that this is not, and I want to be very, very clear, that when we are looking at a racial equity impact assessment, we are not just looking at a Black-white dichotomy. In every state, we are going to have different dynamics in terms of looking at the population of the youth, and particularly the youth of color who are in that state. In this example, though, we are seeing that the large disproportionality in Kentucky happens between our Black children who are in Kentucky, with 18% being in that foster care population. And so context matters. And everything we do, we need to be looking at, not only as we're looking at the individual, the Ma'Khia Bryants of the world, but also looking at the public policy that shapes that system. The ways in which we've talked about that through our learning academies, as even going back as the Indian Child Welfare Act, and looking at how young people who are First Nation young people in this country were removed from their home. And what did that context, what does that history mean as it relates to policies that we have today? And when were we seeing that the shift really was happening among our young people of color within Kentucky? What is it about? Why in Kentucky? We know that our state and our counties are not drastically different from states and counties across the US. So what do we have going on here that's at our community and our organizational and our interpersonal levels, all of these embedded circles that's impacting the ways in which we are able to care for our children and our families around the state. And as I said, history matters. And so the history of race and place within Kentucky has a really critical component in terms of when we are breaking down who are those stakeholders that we want to talk to, or who are those judges, and how have those judges and or those particular authority figures, those reporters, which in our state obviously is mandatory reporting for everyone, how are we viewing others in our community in terms of how that history has impacted what is happening with our racial equity impact assessment? So I start here. This is a public health model in terms of thinking about root causes and conditions. So if we imagine in the tree that you're seeing here, you have the nice lush tree, there is still going to be inequities in that community. There are still health outcomes, poor health outcomes. We can view those health outcomes as there is still abuse, there is still neglect, and there is still opportunities for us to intervene on behalf of children of the state. And other health outcomes that we see that are impacting families: obesity and infant mortality, smoking, violence, HIV and AIDS. When we have a question about how some of these things are insulated at the community, at the organizational, and at the interpersonal level, we can look at the root of that tree. And at the root of that tree, on this lush tree that we see, we know that there's quality schools, adequate income, clean environment, health insurance, quality housing and jobs, and access to healthy foods, all of the things that are really allowing people to band together to say, I will support you and I can support myself. Now, in areas where we see that the tree is not thriving, there are all of those same issues, and those issues are even more amplified. And those amplified issues, they're amplified because of the root of those trees. It has nothing to do with the race of a community. It has nothing to do with the levels of necessarily the ways in which they learned how to be parents, but it does have a lot to do with those areas around adverse living conditions and income inequality, institutional racism, and unemployment. And so we can ask ourselves, how did some roots of these trees, such as poverty and the unemployment rate, how are those roots so much more deeply entrenched than the roots that we have over here as it relates to clean environments and transportation resources? And I like to refer to that as it's what's going on in the soil. And the soil, even beneath the soil, are systems of power. And those systems of power go back to that historical context of racism, sexism, who is allowed to live in a community. It goes back to xenophobia. Are we allowing people who speak different languages to be integrated into our communities in the same way? And those systems of power, those are what we consider the isms in our community. So we don't get to the roots of the tree without understanding the isms, and we don't get to the branches or the lush leaves without understanding how that boils all the way back down to what's going on in our systems of power. So we went through these exercises and had these robust conversations, and then started engaging in this 10-step process or so around racial equity impact assessment. Now, the racial equity impact assessment, it has been used for probably about the last 7 years or so, really largely touted by the Government Alliance for Racial Equity as an organization who has used it, and others as well. And so we start with stakeholder engagement. And in our process, we used identifying who are the stakeholders prior to even talking about the intentional process of the Learning Academy, who do we need to pull into the process? So this is where I'm going to pause for a little bit. And I want you all to think about a program, a policy, or a process that you are currently engaging in your organizations. And I want you to be able to fully think about who are all of the stakeholders, not just who's in my organization, but who touches this issue in any way. So you're going to need to grab a piece of paper, or you can type on your computers, and I want you to use the number 1. And after you write the number 1, I want you to list as many stakeholders. Use this as brainstorming time for you to help build your racial equity impact assessment. So think of one policy, program, or initiative that you're currently dealing with in your organization. And some of you all can, I would love to see if you put that in the chat. Tell me about what those programs are right now. Okay, I'm seeing some great things. A DEI initiative, First Steps and Head Start. I can't wait until after. I'm going to read all of this chat, Leah, so definitely save it for me, because I want to be able to help you all think through how are you working on your initiatives and how are you really engaging. First step, just first step, how are you engaging stakeholders? So what we did, and please have them keep coming through in terms of what you're working on. And sometimes people think, well, you know, this has nothing to necessarily do with race. Some might be very obvious, like a diversity, equity, and inclusion initiative, but some might be, I don't really know how this could impact race. I will let you know, because of what we've talked about the ahistorical is not a thing in this country, that when we look through this lens of equity, we can see how race and the ways in which we have oriented ourselves around those isms, particularly around racism, how that has impacted so much. Even when the Social Security Act was first initiated in the 30s with the New Deal, it was not seen through a racial equity lens, right? So because of that, many Black people in this country who could only have jobs as domestics or farm workers, they were left out of the Social Security Act altogether. And we know that the Social Security Act has provided so much in way of filling the gap, particularly when we think about women who might live longer. That has allowed for wealth to be built in this country in so many ways. And so when certain jobs were left out of who could acquire Social Security, then that wealth gap increased, right? So no matter what the policy or the initiative is, and we know that after the 1960s, that was all changed in many ways. Some of the Civil Rights Act helped to change the Social Security Act even, but I will tell you, I'm a fan of so much that came out of the New Deal and those policies in the 30s, but to also know that so much was left out because we did not look through this lens of who was being left out of the conversation. We have now created decades and generations of the impact of that today. So I hope you've brainstormed about your stakeholders and who you can identify and engage. as we did with the Family First. And we really got deeply into what are the values? What are the values of engaging stakeholders? Why is that critical and important? So I would encourage all of you all, before stepping out and talking to each of those stakeholders that you've brainstormed, really get clear about what those values are and how you're going to make sure that those values show up and are present in everything that you do. And you can circle back to them as well when you're thinking about prioritizing what those conversations need to be. And so for our values of over the 20 stakeholders that were placed in the queue, and we had Post-its up on our board, our virtual board, and we talked about that in terms of starting the process. Some of those values were really focused on family need driven and trauma informed. And you see, the larger the words here in this wordle, the greater of a value that was for the more people, the most amount of people in our group that started this. And so really being able to say, we are wanting to see that families are at the center of this. And so with families being at the center of this, and then youth being a really critical and component of that family need driven and trauma informed, it was important that we involved youth in the ways in which they were able to speak about their experiences in all facets. So we talked to stakeholders who are vast and are continuing that process. Hopefully it will continue for many years to come, because it is not just a one and done situation. And that is something really critical to think about when engaging stakeholders, is how are you following up? How are you showing up for them and seeing ways that you can further engage them in the future? And so for the youth engagement, not only was it important that we were engaging youth from their lived experiences and how important it was to hear their voices and engaging, what do you want to see changed? We wanted to do that from a way that, first of all, removed the agency that they may be most in some ways fearful of. That was a thought that came out, that there might be some fear or disassociation with DCBS as the agency that they have been engaged with some their whole lives. And so it was really important that we worked hand in hand with DCBS to identify youth and agencies, organizations that we could send it out to. But as you see, this is an example of one of the flyers that went out. As you can see, there is no mention here, particularly of a DCBS. It was made very clear to the young people that did apply that DCBS would not have any access to their individual data that was coming out, but DCBS was a part of it. But there was an application process, and we were looking for, at most, if we can get 20 young people to sign up, and we're asking for their time. So we want to pay them for their time, right? All of the professionals, if you all are a professional here today, your time is compensated. And so we wanted to compensate youth for their time as well. And so in doing that, we really talked about paying the youth for their time, as well as making sure that they could know that they were as safe as possible, and that everything would be anonymous. In the 25 that we were hoping for, we had over 100 young people that applied in less than a week, and we're so enthusiastic about sharing their experiences, both good and negative experiences that they had with the state. But consistently among all of the applications, it was, I want to make this better. And I want you to remember that. I want you to remember, when we get to the sustainability indicators, how young people, no matter what their experience has been, is saying, I want to advocate and see change for the future. So engaging stakeholders is critically important, and it is important most at the level of those who are most impacted by the problem. So take a look back at your list, and if you've got someone on your list that is most impacted in a way that has created a disproportional impact for them, most impacted by the policy, program, or initiative, I want you to put a star next to that group. That's the group you're going to start your conversations with first. Okay, show me in the chat that you've got your group starred with either a thumbs up or a heart. And I'll go on to the next phase. Okay, I'm seeing some thumbs up. Great. Okay, so we're all going to engage our stakeholders that are most impacted by the problem and hear from their lived experience. Not just obviously the desk research that we did at first is important, but the most important was how we were and talking with those young people who were most impacted. So then we go on to the next stage, which really is documenting and examining the racial inequities and the causes. So we know that some of those racial inequities existed through seeing that research in terms of as we're disaggregating our data and really looking through the lens and breaking it down to see that 18% is impacted in the state of Kentucky. And that being a disproportionate number, so higher than the number that are in the state, the racial population of Black youth in the state, the disproportionate rate, 18% versus that 9% in the state. So then we want to get a little bit even more disaggregate with our data. So how does this cross over? What is that intersection between young people who are living in poverty and young people who are living in poverty and are Black children or African-American children, or young people who are living in poverty and are Hispanic children? So this information not only helped to show us how many children you see here, 32.2% of Black children and 30.3% of Hispanic children, 19.3% of white children. So we could start to see there's some disproportionate impacts in terms of who's living in poverty alone. Let's not even talk about out-of-home care, but how are we looking through the lens of poverty? And then does that allow us to start to ask a deeper question about, are we seeing poverty as neglect? And is that neglect now being reported because of the poverty, when we can really support those families through services throughout the state? And we also know that when we're looking across the life course, and this is really where the health model comes in, when we're looking across that entire continuum of life, the earlier in life that we are impacted by those negative or adverse experiences that you saw on that tree that was not thriving, the harder it is going to be for our catch up later in life. And so we want to intervene as early as possible when we're thinking about health issues in a country or in a community, and particularly when we're thinking about children within the welfare system. How are we disaggregating those numbers earlier on as well, and not just looking at it by race and ethnicity? And then from there, we wanted to document what is everyone saying about the ways in which we're engaging. So we had focus groups. Every time we had a learning academy, there was an opportunity for us to get on the spot evaluation and understanding about what was happening in community. That is really important for you when you're talking with and engaging your community stakeholders. Not only are you documenting along the process how data might be changing in real time, but you're also documenting their experiences in real time. Another exercise that was really critical and important, and one that I was recently talking with someone, and it was like, they were saying to a class of students that I teach, do you all know what the 5 W's are? And so it is a walking, talking, breathing part of me to go around and talk about the 5 whys. And doing this exercise to really bring clarity to what are those, not only root causes, because there's not just simply one, but which way in those root causes are they leading back to these larger systems that we want to go all the way back now to step one and say, what are new stakeholders that we need to engage as a process of doing it. So as you see in this, it is not simply a linear model, but it is circular because you're identifying your stakeholders, you're engaging them, you're documenting what they say, and then you're going back because there's new stakeholders that you need to identify. So as I did before we go on to step 3, I want you to pause and I want you to think about the policy that you put down, the stakeholders that you starred, and now think about what is a question or a aspect of data that you need to find, the same way that we were looking at poverty and race and age in Kentucky. What is a point of data that you need to find within your particular policy, program, or initiative that will be helpful in having deeper conversations with your stakeholders? So you're going to write number 2, and then you're going to write that particular point of data that you would be interested or question that you're interested in having before engaging your stakeholders. One of our questions here, while you all are thinking of that, was define a problem that is hindering the out-of-home, the reason for Black children being disproportionate in out-of-home care. So according to the 2021 Kentucky Kids Count data, there was a 14.5% increase of children in foster care from 2013 to 2015, and then 2018 to 2020 data that was captured. And additionally, the removals from home occurred at a higher rate for Black children compared to children of other races and ethnicities. So one of the questions that we needed to ask in engaging our stakeholders, not even knowing that this would provide us factual information, but it would get us deeper to the problem, is what do you think is hindering the opportunity, or what do you think is hindering the ways in which our state is creating more pathways for Black children to be disproportionately entering out-of-home care than their counterparts of other races and ethnicities? I'm so interested in some of the questions that you all are asking in your communities. And so if you feel brave and feel that it is safe, I see that some are putting it in the chat. Please put it there. Again, I promise I am reading this entire chat as soon as we are done. And I want to be able to engage more as it relates to where do we go from here. All right, so let's go on to stage 3. So stage 3 is your proposal, and you're going to really be able to clarify your impact, clarify your purpose, and clarify some of your alternatives. So about midway through, we've really started in terms of ideating on the racial equity impact assessment in July of 21. And so now we've had these conversations, we're going all the way through. You saw on that date, we're recruiting in February and March some of those youth to be a part of the stakeholder conversations. We had conversations with staff prior to then. We had held the Health Equity Learning Academy and really started using the language across. And we had also conducted an audit, not only an audit of the work that we were doing in Family First, but a larger even audit with the systems and the services that the Department for Community-Based Services was providing, knowing that that's a lot of where that interaction was happening. And in terms of being able to look at that proposal at that time, midway through the project, and seeing we have some deeper questions we need to ask in terms of how are we defining equity? What is the culture of managing and aligning what is happening at our different levels of leadership. There's an infrastructure issue, and we see that infrastructure issue that was happening both internally in agency, in terms of state agencies, and externally all around the country. Obviously, we know that there was a hiring shortage of individuals, but particularly in some of these most critical areas as it relates to children and families. And so how are we creating that pipeline, not only to develop the infrastructure that we need, but to also get people culturally and educationally aligned with where they are going and what they have to do in their jobs before they're having to hit the ground running. We started to see the data that we have is based on the data that we've been collecting for years and not the data that we need. So maybe we need to rethink and tweak our questions sometimes, because our data is we're not going to be able to look at aggregate data over years' time. We're going to have to ask new questions. And sometimes that means we're going to have to slow down and collect that data along the way. And if our data is not answering the question that we have, sometimes people will say data is everything. Data is only as good as it is as it relates to the question that you're trying to address. So we are starting now, we're in the process of thinking about what are new ways of collecting data and how are we doing data infrastructure audits and thinking about how that data can be visualized differently and how every single staff person can understand what that data means when it comes across their desk. The policies are important in terms of understanding that history of policies on communities, because sometimes this relates to the next in terms of the trust. When that trust is not there because it has been harmed by a previous policy or by previous administrations, then there is going to be incongruency between the services that we can then provide in the community, because partnerships are needed. And those trusted partners are sometimes not the partners who have the access to changing and developing the policies that are at the big P level. And so really being able to go through this process of what is our proposal, what is our initiative, and how do we then, you all have heard me say it before, and I'm going to say it again, how do we circle back? How do we circle back and look at everything as it relates to the start of who do we need to engage now? What are the different questions that we need to be asking ourselves as it relates to the data that we have, or the questions around new data that we want to get? And it was really interesting and exciting in terms of being a part of this process that for some, it was daunting, but to hear these critical takeaways that we have to do a root cause analysis and that we need to explore racism in our communities and how that impacts the clients that we serve. Sometimes the racism that they are experiencing has nothing to do with the services or the ways in which we are engaging with them, but it is going to have everything to do with how they are engaging back with us. And let me be clear, let me be very clear, this does not get the agency off the hook at all as it relates to there are some internal biases and some internal inequities that are happening as well among staff and the ways in which they engage. And so it was doing some of that uprooting as well. And so it was a completely engaged process, not only with the commissioners who were very supportive of this process. Thank you, Commissioner Morris and Commissioner Miranda Straub, but also the Secretary Friedlander was also, what language are we using and how are we making sure that we are engaging partners in a way that is going to move the needle, because that is what we have to be concerned with, moving the needle and not becoming stagnant in our approaches. So finally, I would like before I give you all the time to talk about your, what is a impact that you want to have in your work. Actually, I will do that. I don't want to put the cart before the horse. So take 2 minutes. what is an impact? You know which data you want to ask for. You know who you're engaging. You know who is the most critical in who you're engaging. And you know the policy or program. So now I want you to think about, what is the impact that you want to have? If everything were a perfect world, what is the impact you want to have from the policy that you've thought of doing a racial equity impact assessment on? So put a 3 and then talk about that impact. Okay. Show me an emoji that you've gotten an impact or a purpose written down. Love it. It's a different kind of world here when I'm just looking for the emojis. Wonderful. And then finally, it's sustainability. So that's the stage that we're in now. And I wish I could tell you all that we have gotten it all figured out, and Family First Prevention Services Act is going on without a hitch in Kentucky. And we know that that is not the case, but we are committed. We are committed to the process. The agencies are working together and they're committed to the process. And we've got 5 areas that have already been identified as in terms of really building and aligning for that capacity of hope. Remember that 3-legged stool, that's the willpower, the way power, and the community power. So some of that starts with, what do we know? What do we know that we've already been able to establish? And that what we do know is that multiracial and Hispanic communities, they are the fastest growing groups in our past decade, in this state and in others. And so we want to be as intentional as possible about what do we need to see in our data lines as it relates to multiracial and Hispanic communities. How are we disaggregating data that really speaks to those communities so that in years to come, we're going to be able to see this longer trajectory? How are we also making sure that we have staff? We know now we have staff that are extremely passionate about their jobs and they feel a sense of purpose and calling. And that is what moves people to do the work moves many of you all to do the work that needs to be done in the state. But how are we also being even more intentional about who is culturally and having a community awareness about the ways in which our state is changing? And so that we're not just coming from a place of purpose and calling, but we're also coming from a place of congruency and education around how do we engage in ways that are working best for a community partnership. We know that DCBS is a core agency in connecting the core alignment or connecting the core dots of that tree. And everything that happens at the roots of those trees are going to be touched by what is happening in the entire cabinet for Health and Family Services. Health and Family Services is that health and all policies cabinet within the state of Kentucky. And then the history of social services is also shaped by systems of power. And so for us to uproot those areas of mistrust and trauma and health inequities, we have to be comfortable in talking about what does power mean and how are we going to be really critical that we are not using power for harm, but power for good. So the 5 areas, and then I will stop here. This is it, as I want to give you what our trajectory has been over the past year and a couple of months. In terms of building the capacity for hope, and these 5 A's are really starting to speak to the data that we have from all of our different groups. 1, in terms of the advocacy efforts. those advocacy efforts in terms of creating that authentic and collective advocacy action that needs to happen is something that is not going to be done by the state alone. And so the state, having both DBID and DCBS at the table, needs to have that supportive partnership. We've got great organizations like Kentucky Youth Advocates that are being a great part of how are we pushing and discussing policies that are impacting not only what's happening with Family First in the state, but policies that are surrounding the impact of that. How are we aligning, seeing that a lot of the work that might happen in one particular department in the cabinet needs to also align with other departments, and creating deeper alignment along those departments so that we can have a greater system of care, and that those young people that are falling within multiple, are getting services from multiple agencies, are also seeing that that alignment is clear, that alignment is happening among our data as well, that data is talking to each other, and we're aligning with those community services and those community partners that are not often brought into the fold of what's happening within government agencies. Having access, not only are we wanting to create greater access for families and young people in terms of the things that they need to live healthier and stronger lives, but having access to services and the policies like Family First. What we're seeing a lot in the data is that there are particularly families of color that are not accessing or being put into the pipeline of Family First services. And that disproportionality that is starting on the very front end of the work in which we're doing is trickling through to where we're not really able to have a full picture of what is the racial equity impact assessment of Family First, because there are not the families in the that care system. So in terms of looking at access starts with not only what are the access that points that we have in our community to live well and live whole, but also what are those access points that we have once we are already within the state system. Agency, we've talked about a lot in terms of thinking back to the young people being able to use their voice, and young people to be a critical component of the work in which we're doing. So agency being voice, and agency really speaking to how are young people determining what should happen in their lives. And a lot of that has come out through our critical conversations with young people about wanting to be heard and needing to be heard. And if we think about the continuum or the ladder of youth participation, the highest rung of that ladder, if you all are familiar, the highest rung of that ladder, the lowest rung being manipulation. We're telling youth what to do, where to go, and how they need to be. The highest rung of that ladder is that youth and adults are working together. And adults are really hearing and are being led by what young people are saying. And then finally, accountability. Accountability not only to the departments, but accountability to the public. Accountability in terms of the data in which we're using and how we're sharing that fully. So with Harold, he in the end of the book, he draws his perfect bed and he gets in the bed and he goes to sleep. And you just think about this tool that was put in this young person's hand to be able to draw a world that he wanted. And he just had this one color. And my hope is that as we move forward and as we are looking at all of the ways in which we are changing our lens because of a racial equity impact assessment or others, that we are becoming more than one focused, one colored, focused and dimension, but we're changing our vision and we're bursting in the ways in which we see equity and sustainability of equity in our community and drawing that new world that is possible. So as James Baldwin says, not everything that is faced can be changed, but nothing can be changed until it is faced. Thank you.
Thank you, Dr. Brandy Kelly Pryor. We have some questions. A lot of them came in the chat, and as you can see, it's an extensive chat, so I'm going to do my best. But let's start with the ones in Q&A. So the first question is, or comment, is that the Youth Advisory Consultant form says it's no longer accepting responses.
Yes, so this was at a time in March when we were really doing it. We actually are going to probably open up soon. We're we're discussing doing a data restructure. And so we are going to need youth advocates again to help with that data dive. I would love, if you all are interested, please email me. And when it does open, I will make sure you know about it.
Awesome. The next question is, how can we build this focus and priority into Kentucky's infrastructure so that when administrations change, it is more difficult to dismantle the progress that has been made?
That's a great question. I have a counterpart who, when I was at the Center for Health Equity in Louisville, Stacy Lashley Wibbs, who is at the State Center for Health Equity, is a wonderful advocate in terms of making sure that we have these policies that are really related to health equity and racial equity as being a critical component of that in terms of the state policies. So I would also say that we should work with our state agencies that are currently tasked with doing that work. And if you all need her contact information, again, please email me. I will make sure that Vivian has that information. I don't know if Vivian is on. Oh, Vivian, I see her name. Is Vivian here? I hope I'm not calling out Vivian.
She is here.
Okay, wonderful. Well, I think, in terms of thinking about policies, the Center for Health Equity at the state level is really a great place to do that. So.
Okay, the next question is, are the youth you talked about in the beginning of your presentation still involved? If so, in what capacity, such as training, presenting, CQI, and data collection?
Sure. So the youth that were involved at the beginning, we engaged them for two conversations. And at that point, their engagement they were released of that. They also, some of them said, please call me if there's a presentation, call me if there's something that we can do further. And so, they're young people that range in age from 15 to 25. And so sometimes they are available, but we definitely have their contact information. It was amazing to work with not only KFPC in terms of pulling that together, but also DCBS. And so really, I know that some of those young people were further engaged because in terms of having that application list and choosing there, we talked about, okay, can I contact them for some of the work that we have for a youth consulting group that we want to put together. And so those were other ways in which they could be engaged. Some of the people that were engaged in that process, we also saw that we had people that were not even young people who applied. So they were in their 30s. They just really wanted to share their experiences as well. So some people we could not actually utilize from the parameters that we had in the focus group, but they are still engaged. They are wanting to be engaged further, and they're looking for opportunities to share their stories. And so what that tells me is that we need to be asking more, because there is such a thirst and a hunger for people to share their experiences.
Okay, next question is about youth too. Are there tips you have for involving youth most impacted by this issue, especially if they're hesitant to get involved with our system?
Read that one more time, please.
Are there tips you have for involving youth most impacted by this issue, especially if they are hesitant to get involved with our system?
Sure, that's a great question. So, as I shared, we didn't see the hesitancy as much in terms of getting involved because we had an overwhelming amount of young people that applied. I think the real critical component of why they were as engaged as they were, though probably initially in terms of the applications, were because we compensated them for their time. And so I would really say, and we can do the things in our community that allows us to we can do things that will provide food and refreshments and those things for young people. But I think that a really equitable way is for us to be thinking about how would we want to get involved? What are some things that are going to keep us engaged? And we don't want to have sessions that we had to do things at night. So some of these focus groups happened, into 7:30 in the evening. Some of the focus groups definitely had to involve multiple times that were available because of scheduling conflicts and things of that nature. And so I think it's being as flexible as possible with what may be going on with young people in their particular environments and experiences.
Okay, what data outside of demographic information such as race, ethnicity, and gender can we use to determine if our programs are providing equitable access to services?
So
Do you want me to read it again?
No. I think I'm pausing because I'm not, I'm trying to make sure we get in as many questions as possible, but I'm not the best person to say other than, because I'm like, the sky is the limit with data. Like, what data do you think about? And then let's use it. So I would say, definitely entering into the conversation with race and ethnicity, and then bridging out from there. How are we disaggregating that data? How are we looking at race as it relates to, I identify as a Black woman. So how are we identifying that race as it relates to Black women, Black children, Black girls, Black boys, right? Like there's all these ways in terms of age and gender that we can then start to do it. And then to really think about like layering on top of that, other, areas in which disabilities, or we could be looking at employment. So those are as many ways as you can think about making your data complex. And the word that we use for that is intersectionality, but intersecting those multiple layers of data as possible. So I hope that answers the question, but really there are so many ways to layer data. Again, you can email me and we can talk about your specific data questions. I'd be happy to, chat with you all about that as well.
Okay. What do you recommend as steps our community agencies can take to build hope within impoverished communities?
So I would really start with taking a step back and thinking about what are you doing in the community right now? What is your role in that community? How are you engaging with community members and community partners? I'm working on a project right now, and it's in a community area of a community in which people said, and I reached out to a lot of community partners who are around the area, and they said, well, you're not going to get community partners to show up to that. That particular community never has anyone that engages. Right now, this community advisory board has over 46 members and people are actually knocking down the door and asking if they can engage as well. And so sometimes it takes us taking a step back to say, okay, where's the hope, or where is the ways in which this community is already advocating for themselves and engaging that I am not engaged with? And then in terms of really engaging community further by making sure to ask questions from a level in which they might understand. When I talk about disaggregating data in community, I don't use that term, right? Like I might talk about breaking down data that we can understand what's happening for all of the different sectors or the different components of this particular community. So working on your language and making sure your language is matching language that community members are using. One of the things that I don't use is minorities, right? So minorities is a terminology that really talks about people being, in terms of the number, we might be saying, oh, well, this is the lesser number, but how do we reshift and rethink our language so that we're using language that more appropriate aligns and talks about communities as being already powerful in and of themselves? And then finally, making sure that we are listening as critically as possible to what community wants and then acting upon it. And so when young people were saying in the focus groups, like, we want to make sure that we are having an opportunity to share our voices or talk, let me start looking at things where you all can come and engage, and following back up with you on that. Or we allow them to choose their own names in terms of some of the data. And some people said, no, I want my name to be used because it is really important that you share. And these particular individuals were over 18, but I really want my name to be used because it's important that you're sharing my story. So honoring that in communities.
Okay, next question. What are the ways in which family separation might become or be viewed as an echo of slavery-based family separation? How to prevent this in cases in which relocation of children may be necessary for safety?
Mm-hmm. Yeah, that's a really powerful question, and one that we can't shy away from, knowing that Black communities have been systematically harmed in this country, and even prior to those who were have a history of enslavement in this country. That is a really real reality that lives in the bones of people, that cannot be disassociated from what is happening in everyday lives. And so if we are organizations that are saying upfront and on our websites, one of the things that we will look at in terms of doing data audits is like, what kinds of ways are we communicating externally? Do we talk about the history? Can we say the things, or are we afraid to say the things because we know that people will call us out on the history of our organizations? But if we don't face our history of our organizations and how our organizations have harmed particularly families of color and used under the state's guise or the federal government's guise to say, I want to remove children from homes, if we are not able to call that out, then we are not going to move forward. All of our staff need to be educated in that history and around those policies as well. And so to think about using not only sensitivities towards that, but being really competent and aware of which ways might I be enacting a police state in some ways. Am I the police? Or am I here to really help and support families? I've talked with staff to say in ways that they have not been supported by their management, in terms of definitely calling authorities at times when they know how to de-escalate a situation. So how are you also listening to those who are working in your organization that work for you, not just the agency of those who are in the community and talking from their lived experience, but how are we really lifting up those frontline staff and that passion that they have, and the ways in which, they've been in their offices for the, 12 and 13 hours hold up with a child. And so they know what their child needs best. And we also need to be able to remove some people who are not working in the best interests of our children and families. So that history is real. It lives in the bones of people. And I think for us to all heal from it, we're going to have some intentional conversations about it, and having those intentional conversations without fear and without feeling as if we personally or our agencies collectively are on the, being blamed right in that moment. We need to be open to hearing how that has harmed communities. So
I'm going to ask a follow-up to that, and it's not in the chat, but what if you have someone that's afraid to have that conversation? What are like some basic steps, like how to start being comfortable with that?
Yeah, I would wonder if you can ask the question of, why are you uncomfortable? And even if it's yourself, asking yourself the question, why are you uncomfortable? I have had discomfort as a Black woman studying. I've done research on Black girls, and I said, I don't want to do that. It'll be like I'm navel gazing and people are thinking I'm just caring about myself. Well, if not me, then who? You know what I mean? So same for yourself. There's some reason why you're not wanting to engage in a deeper conversation about that. Maybe you grew up in a home where it is inappropriate for me to say race. It is inappropriate for me to say Black, and I have to Black, white, or Caucasian, and let's just start getting that out in the open and comfortable. There are really good books to read. There's actually Dorothy Roberts, me and my brain and names today. I'm just like, oh my goodness, Vivian is my girl, and I cannot believe it. I'm like, oh, Vivian, yeah. So anyways, but Dorothy Roberts, I believe, is a really great scholar to read about some of that racial history, particularly as it relates to Black children and the child welfare system. And so getting yourself comfortable, so quieting yourself, getting quiet and comfortable about where your fears are about that, and then having a trusted partner and community. One of the things when I had up Equity ABCs as the Instagram community, that is something that I started as a way for people who oftentimes I found in community, people would, because they were in positions of power and they felt uncomfortable with language, they would just act as if they were comfortable, instead of actually saying, I don't know what that means. And maybe that comes from having a 7-year-old who knows so much more than I do. But I oftentimes now can be in positions of power and say, I don't know the answer to that. And let's just talk about it. And clearly you have so many answers for me. So I think that is to a place of how are you really sitting quiet with yourself. One of the exercises that we did in the Health Equity Learning Academy was to write down all of our positions of power. What place do you find privilege? I'm oftentimes the one in the facilitator seat. I have a PhD. I am in a community in which I have a grocery store a mile away from me, all of these things. And so let me write down these privileges. And yes, there are going to be plenty of marginalizations that I can talk about as well. But let me really recognize what privilege I sit in. And once I can recognize the privilege that I sit in, then I can start to draw that one for one of like, oh, that's what make me feel uncomfortable.
Thank you. The next question is, why is it that the children of today have less educational knowledge in math, English, writing, history, and science versus the children that were taught 30 years ago or longer? What's the root cause of this issue?
So one of the most critical things about doing root cause analysis and even just health equity impact in general is that there isn't just one, right? Like there are multiple. You saw the tree and how it had all those roots. And so I would say for that, there's so many reasons. There's so many reasons. But one of those reasons that really, I think, is in terms of the way in which I think we do education now. I have a degree in education policy. And so I'll just say this is only a moment of reflection. This is not the end all be all, but I do believe that it is play. A part of the reason in which we are not seeing as much educational advancement is because we are not providing as much opportunity for play and release and relaxation for young people as well within those confines. And so you might feel yourself, right? Like, what happened during COVID? Was there a lot of just like, okay, it was pause for a moment, and then it was go, 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 go. And now you're like, you got your Zoom meetings and you got your in-person meetings and you got someone on your cell phone. So now your brain is like, so don't take that to the bank, but I would say it was play.
Truth about all the things. So the next question is, were criminogenics evaluated in the disparities of race or in relation to poverty levels in affected children?
Okay, repeat it one more time.
Were criminogenics evaluated in the disparities of race or in relation to poverty levels in affected children?
In our study, no. So, and I'm not clear on what we might mean by criminogenics, but in terms of looking at even crime rates, that is not, that hasn't been even something that we intersected with our other data. So if there's more clarity, please let me know. We do know, though, in terms of talking with our young people, that oftentimes there may have been a parent who either even had a partner who was involved in the criminal justice system, and as a result of that, there was a greater amount of bias towards their ability to be effective as the primary caregiver. And that is the road in which their child was engaged within DCBS, and then through the process and all of the different hoops and all of the different layers, it was exhausting. It became exhausting for the parent and the caregiver, who at some point just, I will no longer kind of continue to engage in this, what they felt was a circus of being able to show up in the way that they needed to show up for their child. And then that led to a domino effect of other things. So I do think, when you're thinking about intersecting your data, we cannot discount the way in which the criminal justice system has had a large impact on areas, particularly as it relates to poverty. If you don't have some of your records expunged for even small crimes that may have happened, then how is that impacting your unemployment and your income? And then how does that then impact the neglect that might be interpreted as it relates to your child? So it is all multiple systems that are churning and working together.
Okay, the next question has an acronym, so we're going to do our best with that acronym, unless the person that asked the question wants to put it in the chat. How would you recommend CPSS get the police officers more involved in community recovery efforts? I think that might stand for Child Protection Service Specialist.
Okay.
Or
yeah,
maybe it's peer supports.
And the question was how to get the police more involved? Certified peer support specialist. Okay.
Thank you for that clarification. How would you recommend the certified peer support specialist get police officers more involved in community recovery efforts?
Yeah, that's it's an interesting question in terms of thinking about police involvement in community recovery efforts. I think in general, I would ask the question, is that where we want to start? Why do we want to start with community or police involvement in community recovery efforts? I think it could be powerful to have every sector of our government involved in community recovery, and what that might mean, and being really open and aware of what community wants in terms of having that recovery start. We know that particularly seeing police in uniform for some marginalized communities has been traumatizing and can be re-traumatizing, even if it is for the purposes of community recovery. For some community partners that I've worked with who have actually been involved in the criminal justice system, they've had great relationships with the police and want them more involved in the work in which they're doing because of the relationships that they have had in the past. So I would just say, you know, really working mostly from the starting point of what do your community members want, and then making sure that you're hearing from them in terms of how would they want to see the police officers involved in that community recovery. And then working with the community, police officers have a mandate pretty much to be more community involved. And so making sure you understand who the point person is for those mandates. Pretty much since the Obama administration, that community policing effort has started. So understanding who those contact points are and making sure that you can work with them effectively and sharing the ways in which would be most useful for the community members to see their involvement.
Someone asked if you can share the name of the book again in the chat, or if not the book, the author's name.
Yes, the author's name is Dorothy Roberts, and I will find the name of the book. She actually just had a book come out, I want to say last spring, related to children, Black children in the welfare system.
I'm putting that name in the chat, and I put it as an answer to the question. So we do have some questions in the chat box too, and I'm going to try to pull some of those out. How could one advocate with our boards of education as a whole to add additional play or relaxed time while avoiding the free downtime for gaming, computer time, etc., but add additional outside time such as with sports, ROTC, basic games, and activities? So how do we advocate with our boards of education?
For better gaming, better playtime?
Yes, playtime and gaming that isn't online gaming.
Sure. So there are really great advocacy groups. The National Recreation Parks Association is one that does a lot of that gaming in terms of play, and there's play resource groups around the country that are advocating for that. I would say in terms of starting with the boards of education, there are probably not many advocates right now that are like, yes, let's have more playtime. So that starts with some of those small groups that can pull together and say, oh, we want to create this group in the schools where we're bringing more playtime into the school space. There's a whole host of ways to do that, but I mean, pretty much with school being one of the places that most of our young people are going to spend the most amount of time, it's those counselors at that school have been some of the greatest support personnel, and those teachers have been those greatest support personnel for our young people who have been in our focus groups so far. And so in thinking about ways in which they can have just really youth spaces and places, not only working in the schools, but what are we seeing in terms of those Boys and Girls Clubs and the YMCAs, and how are we really advocating that those spaces are funded in the communities that we need to have them the most. They're considered in some way second spaces or third spaces, like homes for these young people. Libraries as a place where they can also find time for play and relaxation. And out of that, really, it does have a great intersection with the child welfare system. If we're thinking about, some of our earliest social workers, for better or worse, it's some of the racial inequities that were probably involved in that, but Jane Addams really started the playground movement in terms of thinking about immigrant youth and how are we engaging them in play. So I love that question. I love that we've gotten off on this tangent about play, because there is a lot of intersection with the ways in which we can hear youth voices more critically and engage them more sustainably by allowing them to just have that authentic and organic space of being free. So yes, work with the counselors, work with the Friskies. I wouldn't say that the school board might be the best place to start with that, but also ask those questions of your school board candidates. Election coming in November. So ask them, how do you feel about play in the school, and make your votes accordingly.
We also have a comment in the chat. There needs to be more safe supports in the communities, such as faith-based programs, community sport programs, youth agencies to help build community with young children and families. It would be great as well if police get involved in community activities on those levels, not in uniform. It would always be great for police academy recruit efforts be in those communities, so that police come from the communities. They are not an outsider.
Yeah, it's really interesting to hear that about, police academy leagues that were a big thing of the past, and especially as it relates to some youth sports and basketball programs, and how closely connected people felt in terms of their local police. I think beyond just police, though, thinking of the other authority figures that are in communities, how are they coming from communities? So the teachers, the social workers, thinking of who you all have the power of hiring. How are you all making sure that you are being really intentional about hiring from the communities in which you're serving? I think oftentimes there is a bias towards that. And I will say, as someone who is a transplant to my community, I've lived in my community for the past 7 years, and I remember coming and hearing a lot of pushback in terms of, there are people here that can do that work too. So I am more than aware of what it means to be a transplant into a community. And also, how do you, if you are that transplant, how are you making sure that you are really linking and locking arms with community folks, and making sure that, again, they are in the seat of decision making, and you are, as we would do with youth scaffolding, that you're doing that with community members, and you are making sure that all of the opportunities that you have, and when we say from the community, sometimes we mean physically from the community in that zip code, and sometimes we mean from the community in the ways in which community is described by that particular person. That can be language, that can be religion, that can be race and ethnicity. I know in terms of looking at some of the state data we have, and this is around the country, so I don't want to make it seem like it's just Kentucky, but there is a disproportionate amount of white women who are in social services within our state. And so when we're thinking about that same congruency among the children who are coming within the state system as well, are we seeing men Are we seeing men of color? Are we seeing women of color in positions? And how are we being intentional about doing that as well? So community can be broad as well as even more specific about space and place.
That's a really good reminder. Can you reference the studies that support the need for play within the educational setting that the peers can utilize for reference when going in front of boards with data to support their advocacy efforts?
I will look for some of those. Whoever is asking, Leah, you can make sure that I have their email address, and then I'll make sure to get you some of that information. Come on, play advocates. This is fantastic.
Michelle, if you'll shoot me an email with that in it, I can forward it to Dr. Brandy Kelly Pryor for you, and I'll loop you in on that email.
Okay, fantastic.
Okay, mental health is an element that is embedded in every aspect of a young life. Should there be a larger focus on mental health in schools?
Absolutely. Whoever asked it, let's put you on a bullhorn. Mental health is one of, when we're thinking about and when I say play in terms of school, when the question was asked about math and science and history and all of that, it has a lot to do in terms of the capacity that our brains have to grow and flourish, has a lot to do with our social emotional health as well. And so, yes, if mental health, if we can have more trauma-informed schools, even in thinking about not only the ways in which teachers are teaching and that mental health is able to flourish, but the ways in which those buildings are constructed. How are we widening some of those hallways? How are we having the low lighting? I remember I went in for, I gave birth to one of my children, and the nurses were coming into my room because they were like, this is so calm in here. It was like, I've changed the lighting, I've changed the smells, I've changed everything, because I recognize how important it is just in that process, that physical process, for me to feel comfortable. So if we're thinking about young people who are coming to school with a whole host of things that are happening in their spaces and their worlds, and this is the only place in some cases that they have to feel calm and relaxed, and why don't we construct our buildings differently? Why don't we construct our day differently? And knowing, especially in the county in which I live in, the amount of teachers that have departed the school system, knowing that for them too, they want their mental health supported. So I think, yes, that is a really a wonderful addition of how do we have greater mental health components as a part of the school day? How do we incorporate that mental health into play? And how do we incorporate that mental health also into our own agencies and what's happening in child welfare? Are we thinking about, I know one of the questions earlier was about, involving the police or CPSS, involving the police. What are some of the ways in which we call mental health advocates first? Or what are some of the ways in which we implement yoga and breathing exercises? Some of our young people really are in many ways just seeking someone to let them breathe.
I'm gonna go a little bit out of order in the Q&A because this one relates. Someone made a comment that said teachers, workers, parents, etc. could do research on Montessori schools for ideas on integrating play and active learning in the classrooms. And then I'm going to go back to the questions. What we now call community policing has its roots as a model in slave catching. How do we reform policing to radically change the trajectory from catching humans to freeing humans from harm?
We are getting into a whole nother talk. So one of the practices that we have 4 main values that we employ in BKP strategies, and it's in the acronym of HEAL. And so hope is a verb, Equity is a collaborative process. A just world is possible, and liberation is the sustainable goal. And when I think about that last one of liberation is the sustainable goal, it is really thinking about how do we manifest new thinking about everything that we have thought about before. The status quo, there's a quote from Martin Luther King that talks about we will, although our hands will be bruised because of it, but there is a possibility to turn the tide of a recalcitrant status quo, and meaning that it is obstinate, it is unyielding, it is the way that we have always seen things. And if we are going to get to a new world that is possible, a just world that is possible, then we need to shift all of our thinking about the status quo and everything from the way in which we've viewed power in this country, which power is largely enacted by, there's 6 forms of power, but one of those forms of power is violence. And one of the main purveyors of that form of power in terms of getting people to do what you need them to do is military and policing. So government uses power in those ways to really enact what has to happen in a community. And so I think, in terms of the history of policing and how policing has started, it's important for us to know that. And it's important for us to know that status quo does not have to be. We can have new and imaginative ways of thinking about how do we construct the communities that we want.
Okay, here's another one from the chat box. How do we advocate for our pregnant women that struggle from drug addiction?
Mm-hmm.
It seems that they are put on Subutex and not even tried to taper them off. This would help our children and reduce the amount of babies that are born addicted.
Mm-hmm. So it's the same with drugs in our community and substance use of any kind. We have to think about what are the root causes of that, the multiple root causes, and how can we support people even earlier in their experience in terms of those root causes. How are we making sure that we are, again, attending to the mental and emotional health of people, and so that we are not blaming, and that we are really helping to heal communities who have struggled with substance use in our communities. And then also, how are we making sure that when we've passed the stage of the primary prevention and we've passed the stage of secondary prevention, and now we're deep in it and we're looking at the tertiary, what do we do? This child is now deeply impacted because their mother has been deeply impacted. Then how are we building those supports around both of them and their entire communities around them, thinking about those embedded circles? So that mother, how is that mother supported with all of the nutritional needs that she has, with all of the mental and emotional support needs that she has, to be able to, move in a place in which those substances are no longer a part of her life? How are we making sure that all of those community members and those supports, that family and that interpersonal support, how are they all supported with all the things that they need as well? Because that is also, how are we making sure that we have housing and that, we're not just supporting that mother and that child and that father and or other parental person in their lives, that we're not only supporting them in terms of that 0 to 3 months or that 0 to 1 year, but we know, especially with women who are gestating and have had substance use issues, that support is going to be needed why aren't we giving that support up until 3 years and 5 years, and really wholly surrounding that is that system of care, of making sure that that entire ecosystem is holistic for the health and the well-being of that mother. And then that mother has that health and well-being that can also be for that child. And so really keeping that family unit, if that is what is desired, keeping that family unit tight by allowing that recovery to happen in process together.
And someone put in the chat, and that's just another response to the question we just asked, that was a great plug for the use of early childhood mental health program through the CORE grant, which is the Kentucky Opioid Response Effort grant. And if you want to know more information about that, or anything about substance use disorders, you can reach out to our department. You can email me and I will forward it to the appropriate staff person. And that looks like all of our questions in the Q&A, at least. We may have missed some in chat, but we did a really good job. I want to thank you for your time today for this awesome presentation. You are getting so many accolades in the chat box. That's one of the reasons I can't find the questions, is because so many people are saying thank you, which is awesome. This is one of the most active chat boxes I've seen in a long time. So thank you for your engagement for our audience. And if anybody has any questions, feel free to either email Dr. Brandy Kelly Pryor or email me. We'll put our emails in the chat box. And Dr. Kelly Pryor, if you'll put another link in there to your Instagram, not necessarily link, but just where to find you on Instagram, that would be appreciated. And I have people asking, where will evaluations be posted? And just as a reminder, you'll get a link in the next coming weeks that will have, it'll take you to an MTS tracking site where all of our conference certificates are housed. You'll do a session evaluation, and then you'll be able to print your certificate. You can't access your certificate without doing the session evaluation. And as a reminder, you have to have been present for 90% of the session in order to be eligible for continuing education credits or certificates of attendance. And we follow the licensure board rules on that. So do you have any questions for us, Dr. Brandy Kelly Pryor, or any last thoughts or comments?
I would love, just because this is really how the Instagram community will grow in terms of before you go, if possible, just put one word in there that you want to have more information about. And then I'll try and post something specifically for you. So one word, if it's like, I don't know what you meant by data or disaggregate or equity or play. We talk so much about play and I'm so happy. It's like my heart. So I wasn't coming here to talk today about play, but you all have been, like I said before, there have been so many people that I saw in the chat that were talking about the programs that they're doing. You've got this. You need some help and assistance, I'm sure, because it is a learned process, but definitely reach out to us if we can help in that way. But for the most part, thank you. Thank you for the work that you do. Thank you for the work that you do in children around Kentucky. Thank you for the ways that these systems have been set up. As I said before, with Vivian Lastly-Bibb's office, it has been doing the work for a very long time in Kentucky. And so that is something that you all should be proud of, that you've got the organizations and the agencies here to help you move this work along. And for those of you who are not from Kentucky, I would really hope that you would reach out to all of those who are on the ground doing the work and sometimes moving in silence in ways that they really need your support as well. So thank you.